Patients require access to a specialist dietitian with expertise in head and neck cancer, and that's part of a multidisciplinary team that they'll work closely with the nurses, doctors and the speech pathologists who are also part of that core group of the multidisciplinary team. And essentially that dietitians are a part of comprehensive cancer care. It's not really an optional extra on the outside. We have grade A recommendations, so very high level and high quality evidence that patients require access to a specialist dietitian in head and neck cancer, that they are seen early and prior to treatment, that they're seen weekly during radiation, that they're seen fortnightly post-treatment, and for as long as is necessary, to the fact that they are able to eat and drink adequately again to maintain their nutritional status. We would encourage people to make sure that they have contact with the dietitian early in their care, and so that they get the right advice about how to manage their nutrition throughout treatment. It may be a range of options. There can be, in terms of oral nutrition support, there may be a range of high protein, high energy strategies that maximise the energy and protein intake. Some people will need the texture of their diet modified if they're unable to chew and swallow food as they would usually, and they may also need advice if they are going to require a feeding tube through treatment of how to manage that and become independent in managing their own nutrition care needs. It can be quite varied depending on the nature and extent of disease and the degree of treatment someone's having. Typically feeding tubes are temporary, but it's what goes towards helping keep someone well-nourished, well-hydrated and out of hospital. For some people it is a longer term requirement. It may just depend on how much surgery they've had or what other complications they have. But again, that's why they need to be in touch with a dietitian as part of a specialist head and neck cancer unit.